one testis usually produces about 40 to 50 million per ml. That is more than enough for reproductive purposes. Because
so joining us tonight is Dr. Sharath. He is a sexologist and an IVF specialist based out of Bangalore. He's got his practices in Mangalore also. We are very
Mysore.
Yes.
Mysore.
We are very fortunate to have you with us, Dr. Sharath. And it's a series in order to understand male fertility. And we have segmented into 3 portions. One is the testicular cause of subfertility. Today, because testicular causes of subfertility. And next session, we're going to discuss post-testicular causes of subfertility.
Right. That's right.
Right.
Yeah.
I'll just sum up whatever little thing that I know. I have said.
No, you would have come well prepared, I know.
No.
Should have read it. Yeah.
So,
last time also, you were well prepared and your questions were excellent. To the point.
Thank you so much.
Yeah.
Really means a lot, actually.
Yeah. Please go ahead, Jamil.
Yes. So testicular causes is anything related, which is like undescended testicles. It's also caused by excessive drinking, smoking, trauma to the testicles. If anybody has been through prior chemotherapy or radiation, that also is a cause. Testicular cancer, genetic factors, infections, and prescription drugs, all these come together and can be factors to cause testicular cause of subfertility in male.
Yes. Right. You have covered everything, Jamil. Sure. What you have left to me?
Well, to have a more wonderful conversation.
Wonderful. That was very nice. That was a summary of what I'm going to tell today.
Right.
So, good evening, friends. I am Dr. Sharath Kumar, sexologist and infertility specialist. This evening, I am going to discuss about the testicular causes for male infertility or subfertility. See, last time we discussed the pre-testicular cause of infertility in male. Next week, we are going to cover the post-testicular causes of male infertility or subfertility or sterility. So, we had divided the male infertility into 3 groups. Those who have joined only today into 3 groups. That is pre-testicular cause. That is the causes of infertility before the testis. That covered the hypothalamus, thalamus, and general causes, general diseases, diabetes, and other malignancies, and other causes, hypothyroidism, and other causes which control the spermatogenesis. That we had covered. And today I am going to cover the testicular cause of infertility in male. That is, when we do the investigations on male, all the reports regarding the hormones, regarding the external genitals, everything will come normal. But only thing is, the testis is the thing which is having the problem. That is, when we do the test for the pituitary fossa, it will be normal. Genetical causes ruled out, hormonal causes ruled out, post-testicular cause, that is obstruction ruled out by doing whatever the test relevant to that. But after all the investigation, we come to the conclusion that the testis is the culprit for the cause of infertility. Then we call it as testicular cause of infertility. But friends, I would like to underline here, many times it will be mixed cause. It will not be specifically testis or specifically hormones or specifically the penis. Many times it will be fixed, the multiple factors will be there. But today I'm going to cover only the testis. And as Jamir has already told, varicocele is one of the main cause of testicular cause of subfertility, because the varicocele increases the temperature of the testis, so that the testis, though it is morphologically normal, though the testicular report comes as normal, the testis is normal, epididymis is normal, but still, because of the rise of temperature by the varicocele, the subfertility occurs. Here, there may not be azoospermia, there will be oligospermia or cryptospermia or oligoastinospermia, oligoastinospermia. Any of these things can happen when there is varicocele around the testis. That because the testis, we cover the scrotum, it will be classified as a testicular cause because many times the scrotum and testis, they overlap each other anatomically, and varicocele is the main cause of infertility, especially if the varicocele is of the grade 3 and 4. Grade 1 and grade 2 varicocele may not cause subfertility. The second cause is infection. Any infection to the testis, either in the childhood, mumps or diphtheria or cholera or typhoid, which also affects the testis. It will cause orchitis. And many times it will be epididymoarchitis. Both epididymis and testis will be involved. Many times when it is bilateral orchitis, bilateral epididymoarchitis, bilateral epididymitis, it will cause destruction of the testicular cells, the sertolate cells, that is sertolate cells which produce the spermatids, they are destroyed. If the sertolate cells are destroyed, spermatids will not be formed. Even if the spermatids are formed, they will not be transformed to spermatozoa. That is the transformation of the germ cells into the full-blown spermatozoa cannot occur. And if there is infection of the epididymis, that is called as epididymitis, the maturation of the sperms will not occur. That is, the sperms are produced, but when we see this one, the pathologist says spermatid only. That is, the spermatid are there. They are not converted into spermatozoa, and they will not be converted into the live sperms, that is, which swim with a full-blown tail, head, neck, everything. So there will be some part of the sperm where maturation fails when there is infection of the epididymis. Friends, the maturation of the sperm occurs in the epididymis. Production occurs in the testis from the sertolate cells, but maturation occurs in the epididymis. So any infection can cause decreased count, and it may cause subfertility or sometimes the sterility also. The third one is sometimes there will be anti-sperm antibodies reaction inside the testis. That is, autoimmune disorder may be there inside the testis that causes the sperms to failure to mature. That is another possibility.
Does this
and next, antigen
this
antibody reaction.
Is this a case where your own body is not allowing or attacking your...
Yes. Antigen antibody, autoimmune disorder.
Right.
That is, the sperm production will be stopped by the immune system. That is called as autoimmune disorders. So that is another cause. And the next cause is tumors. Oh, 1 second. Can I take a small break?
Yes.
No, recording. Yeah, sorry for the interruption. There was some disturbance. I asked them not to disturb. Sorry, you can edit it later on. And the next one is tumors. Testicular tumors are quite common. Seminoma, carcinoma of the testis. And once there is a testis, believe me, there will be total destruction of the architecture of the testis itself. That is, the sertolate cells are destroyed. So there will be complete stoppage of the production of the sperms once there is cancer, carcinoma of the testis, not only by the disease, also by the treatment given to the tumor. For example, we may have to do orchidectomy, removal of the testis itself, or we may have to give radiotherapy or chemotherapy. So cancer, that is tumors, as well as the treatment following the tumors will cause oligostenospermia or azoospermia. That's why many times when the cancer is detected, we immediately ask the person to store the semen, because by that time you wouldn't have started the chemotherapy or radiotherapy, to store the semen so that that can be used for IUI or IVF later on. Because most of the times when the cancer is detected, the total destruction of the testis may not have occurred. And luckily, the other testis may be functioning at that time. So before we start chemotherapy and radiotherapy, which will destroy both the testes, we ask the person to store his semen for future use for the reproductive purposes.
Mhm.
That is the one. And as Jamir has already told, cryptorchism, that is the undescended testes, both the testes will be in the inguinal region or somewhere in the higher up in the abdomen. Once the testes are not descended into the scrotum, they will not mature completely. They will be small, tiny, because they cannot expand inside the abdomen or in the inguinal canal. They'll be so tiny. It will be the volume of each testis maybe only about 1 cc, 2 cc. Normal volume of the testis is about from 12 to 18 cc, normal volume. And these undescended testes, if you measure, they will be usually 2 or 3 cc per side. So they will not be producing the sperms. Even if you detect the testes in the inguinal region or in the abdomen, even when they are brought down to the scrotum and fixed, that is called as orchidoplexy by surgery, they will not function because the date is over. They are already atrophied. They are destroyed. They cannot function. Even surgery, even if it is done, they may not function. That is regarding the undescended testes and atrophied testes. So the next one is the hormonal imbalance. The hormones which control the testes. So they also, the hormones may be normal, but testicular tissue may not be responding. That is called as hypergonadotrophic hypogonadism. That is when we measure the hormones, FSH is normal, LH is normal, testosterone is normal, DHA is normal, prolactin is normal, but the testis is not responding. So there is some cellular deformity where the end cell, that is the receptors, may not be functioning. That is due to the testicular cause. This should not be mistaken for the pre-testicular cause where the hormonal imbalance would be there. In hormonal cause, the hormones are there, but the receptors present in the Sertoli cells and Leydig cells, which are responsible for the production of the sperm, they will not be responding to the hormones. That is called as hormonal cause of infertility of the testis. The next one is, of course, defect in the tubules. That is, the spermatids may be producing the spermatozoa, but the ducts inside the testis. I'm not talking about the vas difference. I'm not talking about the ejaculatory duct. I'm not talking about the common ejaculatory duct. I'm talking about the small ductules which are there inside the testis. There may be obstruction. There may be obstruction in the epididymis. There may be obstruction in the tubules, what we called as tubules. So then also there will be a low count or azoospermia. At that time, when we put a needle into the testis and draw the fluid, we may get the sperms also. That is called as obstructive azoospermia. Not obstruction to the vas deferens, but obstruction to the tubules inside the testis. And the other causes are injuries, torsion, that is the twisting of the testis. If the torsion is not relieved within few hours, the testicular tissue may be dead. That is one of the cause. But luckily, torsion of one testis may not cause oligostenospermia because the other testis may be functioning. But if the person has got one testis dead due to undescended testis, or the other live testis, it gets torsion, then the problem arises. So if for a person to reproduce, one testis is enough, one functioning testis. But many times what happens is, when there is a disease to one testis, if the other testis undergoes some problem, then all these things occur. All the problems will occur. Torsion, injury to the testis, especially cricket ball injury for those who play cricket. Directly the ball comes and hits the groin if the person is not wearing a guard. That's why whenever any person plays a cricket ball with cricket ball, hard ball, cork ball, they must have the scrotal guard. Even other athletes who are exposed to some sort of injury, it is better they wear the guard, that is scrotal guard.
Right.
The other,
I'm going to take us back to some terminology so that we understand. for all these terminologies about the sperm thing, sperm which are immature or abnormally shaped is called teratospermia.
Yeah.
This is for our viewers' benefit and my benefit also.
Abnormal morphology.
Yeah.
Yes,
and
morphology is abnormal in teratosperm.
And sperm.
Oligospermia is reducible.
Yeah, sperm which are unable to move properly is called astenospermia.
Astenospermia.
Yes.
Astenospermia.
And sperm which is produced in an abnormally low number due to variety of is called oligospermia.
Oligospermia. Yes, you're perfectly right.
A complete absence of sperm is called azoospermia.
Yes, perfect. Yes.
So for our benefit,
Yeah, you are perfectly correct. That is aspermia, azoospermia, oligospermia, astenospermia, and teratospermia. And many times there will be mixed of all these things.
Oh.
Oligostenospermia, oligosteroteratospermia. See, there will be combination. A person may have low count as well as abnormal forms. A person may have low count, low motility, and abnormal motility. All the combinations can occur out of these.
Yeah. So you did say that even if one testis function, they can still produce.
One testis is enough because the count may be slightly lesser, but it is adequate for reproduction. Because the normal count is something like 50 million to 150 million. But what we require is only 15 million to reproduce. So if one testis usually produces about 40 to 50 million per ml. That is more than enough for reproductive purposes. Because the God has created the testis to produce 50 to 150 million. But the minimum requirement is only 15 million. That is 15 million. 15. So luckily one testis can produce at least 30 to 40 million in a normal individual.
Right. So
that is one testis.
One testis can get their partner pregnant. But for those who want to improve their testicular function, what can they do? What is your advice?
I'll just complete the other three causes for oligostenospermia. So before going to the treatment, the other one is medicines, excess medications due to any disease. They may reduce the sperm quality and quantity. And as I told earlier, the chemotherapy or radiation therapy for any other reason, not for testicular tumor, any reason, for example, pelvic tumors or colon cancer or cancer of the head of the femur, where we may have to give the radiation directly to the pelvis, then the testicular tissue will be damaged. And chemotherapy due to any cancer, because chemotherapy directly goes to the blood. And since whatever the tablets or injections go directly and they destroy all the fast growing cells in the body, germ cells especially, because germ cells are fast producing. Every day, millions and millions of spermatozoids, they undergo mitosis and meiosis and transform spermatid to spermatozoa. So these fast growing cells are affected by radiation and chemotherapy. So, Jamir, these are all the causes of testicular causes. Now you are open for your question. That is, you kindly repeat the question for myself as well as for the viewers.
Yes.